Welcome to the deep dive. Today, we're really digging into something absolutely central, not just for being a good doctor, but definitely for tackling the MSRA Situational Judgement Test. That's medical professionalism.
Yeah, and it's easy to think it's just about, how you look or present yourself.
Right. But it goes so much deeper, doesn't it? It's about your core values, your attitude, how
Yeah.
you handle responsibility.
Accountability.
Exactly. And it's not some fringe topic.
Yeah.
Professionalism is, well, it's a cornerstone of the GMC's good medical practice, the 2024 update especially. It really underpins everything we do.
And for all of you getting ready for the MSRA SJT, getting your head around this domain isn't just, an exam tactic. It's fundamental for your whole medical career. So our focus today is pretty sharp. We're going to break down the key aspects of professionalism that you'll actually be tested on in the SJT. We're using insights from medical professionalism for MSRA SJT success, and also the MCQ Vault learning sheet on commitment to professionalism.
Good resources for this. Definitely. The mission here is clear. We want you to leave this deep dive with a solid grasp of the professionalism domain, feeling confident for the SJT.
Okay, so where do we start? What kind of professional behaviors are they actually looking for in the SJT? Both those sources give a pretty clear picture.
Right. Let's unpack that. Looking at both the Medical Professionalism Guide and the MCQ Vault sheet, specifically that bit on what the SJT tests, there are some clear themes. First up, acting with honesty, integrity, and trustworthiness. Sounds basic, maybe?
It sounds basic, but the SJT can test it in subtle ways. It's not always about outright lying.
How so?
Well, think about being uncertain about a diagnosis. Honesty there means saying, I'm not sure, and seeking help. It's about prioritizing the patient over, looking like you know everything. That actually builds trust.
That's a great point. Honesty and admitting limits. Okay, next trait. Being reliable and accountable for your decisions. What trips people up here?
I think sometimes it's about assuming someone else has it covered. In a busy team, it's easy for tasks to fall through the cracks. Accountability means you own your part, you see it through, or you hand it over properly. It's active, not passive.
Yeah, taking ownership makes sense. Then there's ethical awareness, and the sources really highlight confidentiality. How's that tested beyond the obvious don't gossip about patients?
The SJT might use scenarios where the lines are a bit blurred, maybe discussing a case even anonymously in a public canteen, or on social media thinking it's anonymized, but maybe it isn't quite enough.
Ah, right.
So ethical awareness is this constant filter, isn't it? Thinking about potential privacy risks everywhere.
Got it. Maintaining that professional boundary. Okay, another big one. Identifying and challenging unacceptable or unsafe behavior. This feels like a tough one for junior doctors.
It really can be.
Yeah.
But patient safety has to come first. The sources suggest a kind of professional escalation. Maybe start with a quiet, respectful word with the colleague if it feels safe.
Yeah.
But if it carries on, or if there's immediate risk, you absolutely have to escalate it. Go to your supervisor. It's a responsibility, regardless of how junior you feel.
That's crucial, knowing when to talk directly versus when to escalate formally. What about making mistakes? Accepting responsibility for errors or omissions. It's hard to admit you messed up.
It is, but transparency is vital. The professional thing, even for a near miss where no harm happened, is own up, report it through the proper channels, Datix, or whatever system is used locally, and then, importantly, reflect. Why did it happen? How do I stop it happening again?
Right. It shows you're learning and committed to improving care.
Exactly.
And the last one listed is upholding the standards expected of UK-trained doctors. That sounds quite broad. What does it mean in SJT terms?
It kind of pulls everything together, but it also includes things like keeping up with your professional development, knowing the GMC guidance beyond just good medical practice, like on consent or raising concerns, and just generally behaving in a way that keeps the public trusting doctors.
So it's the whole package, really.
It is. It's about embodying those UK medical standards.
Okay, let's make this more concrete. We can look at some scenarios like the ones from the MCQ Vault resources mentioned. Scenario 1. Imagine a colleague is often late for handover, misses key patient info. What do you do? What's the priority?
Well, the immediate worry is patient safety, right? Incomplete handover is risky. So even if it feels awkward talking about a colleague,
Yeah.
the professional step, according to the sources, is to raise it. Talk to a supervisor, explain the concern professionally. Patient safety trumps the awkwardness.
Makes sense. Okay, scenario 2. You prescribe the wrong dose. Whoops. But you catch it before it goes to the patient. A near miss. What now?
Phew, relief. But professionalism demands more. You can't just forget it.
No.
No, the sources stress transparency. You report the near miss, follow the local process for that, and then you reflect. Properly reflect. Why did that happen? What systems failed or what did I miss? It's about accountability and learning.
Okay, got it. Report and reflect. And it's really important for everyone listening to get that these scenarios and the right answers aren't just made up for the exam, they tie directly into GMC standards.
Absolutely. Our sources keep referencing Good Medical Practice, the 2024 version. Things like confidentiality, respecting privacy, only sharing when justified, patient's best interests. It's all in there.
And the GMC's guidance on raising and acting on concerns, that directly shapes how you handle that late colleague scenario, for example.
Precisely. It says you have a duty to act if care or safety is compromised. Even if it's difficult, you have to speak up appropriately.
And there's other GMC stuff too, isn't there? About avoiding conflicts of interest, professional boundaries, not being deceptive. It all feeds into this idea of professionalism.
It does. The sources we're using basically help translate that GMC guidance into practical SJT context.
So turning this into practical advice for the SJT itself, what are the top tips from the Medical Professionalism Guide and the MCQ Vault sheet? How do you score well in this domain?
I think a really key message is, don't be passive. If patient safety or ethics are on the line, you need to act. Doing nothing or just hoping it goes away is usually marked down.
Be proactive. Okay.
What else? Don't cover for colleagues if it means compromising care. Teamwork is important, obviously, but your first duty is always to the patient.
Always patient safety first. Got it.
And as we said with the error scenario, own your mistakes, even small ones. Showing you learn from them is a sign of professionalism.
Right. Acknowledging errors. And finally,
Aim for consistency. Apply these principles, honesty, accountability, patient safety, across all the scenarios. The SJT is looking for that consistent professional judgment. It shows you've really internalized these values.
that makes a lot of sense. Consistency shows it's not just guesswork.
Exactly.
Now, if you want to really practice this to get comfortable applying these principles in exam-like situations, both our sources mention the MCQ Vault, MSRA SJT Clinchers course.
Yeah, that sounds like a useful tool. It apparently has, what, over 1,100 scenarios?
That's right, 1,100 plus handcrafted scenarios. And they're specifically built around these core GMC values: professionalism, integrity, patient safety, all the things we've been talking about.
Okay, 1,100 plus is a lot of practice.
It is. And the thing that both sources highlight is the reasoning. For every question, you get examiner-style reasoning explaining why the best answer is the best answer.
So it's not just about getting it right or wrong.
Exactly. It helps you understand the thinking behind it, the principles involved. You learn how to approach these situations, which is the whole point, really.
That sounds incredibly valuable. Learning the RAI helps you apply it to new situations you haven't seen before, both in the exam and, in real life later.
Absolutely. So let's kind of wrap this up. Professionalism, honesty, accountability, ethics, speaking up. It isn't just an exam module, is it?
Not at all. It's fundamental to being a doctor people trust. And yes, it's also critical for getting through the MSRA SJT.
So internalizing these principles, practicing them, maybe using resources like that MCQ Vault course seems key.
It really does. It's about building those professional muscles, enhancing your exam performance, and becoming the kind of doctor you want to be.
So we hope this deep dive has given you a clearer picture. We encourage you to keep these principles in mind as you prepare. And maybe a final thought to leave you with.
Go on.
Think